what's the motivation of a doctor to say, you know what, I will test the T3 and free T3 and reverse T3? What is holding them back? Don't they get paid every time you come into the office? Or is it the fact that they don't know how to prescribe certain medications that will address the free T3?
Yes, all of the above. So you have to realize that the doctors are taught in med school it's a very simple formula and it's called standard of care. So this is how your doctor mainly operates is under this standard of care that's set in place by the insurance companies to say, we'll pay for this, but not for this. And doctors are taught about the thyroid that you test TSH. And if TSH is above a 4.5, then you give Synthroid. I mean, it's a very nice, easy little diagram. If this, then this, then this, done. But in reality, if we plot it out, you're testing these 5 different markers. And if this, then you might go that way and add this in over here and throw in some T3 to the NDT, or maybe that person is T3 only. I mean, we have a million different ways to go with the thyroid because the thyroid really is that nuanced. So there was one time, I tell the story all the time because I find it fascinating. I was talking to a group of integrative wellness physicians. So they even had integrative in the title of their practice. Like that's what it was. LeCom Integrative Wellness Physicians. And I'm talking to them about number one, testing reverse T3, how important it is. They were already testing the free T3, but they were leaving off the reverse. And I said, this is the importance of testing the reverse T3. And then I moved over here and I said, we all need to, as providers, get out of the Synthroid box. And what I described was, everybody's in this T4 box. And it's just what I said, if TSH is above 4.5, then you give T4. That is it. You don't do anything else. I said, if somebody comes in depressed, you'll try 5 different antidepressants on them until you find one that works, or you might even combine 2 of them and throw in a sleeping pill. But for thyroid, you give one medication. Why is that? One doctor raises his hand and goes, that's all we've learned.
Yeah.
And I paused for a minute and I was like, well, first of all, thank you for being honest. That's awesome that you can just openly admit that. Number 2, then we need to change. And
Yeah.
then it's our job as providers to expand our knowledge and realize that there are different ways to do things out there to better help patients. So long answer to a short question, but it's all they've learned.
Yeah, and I was just listening to Casey Means on a podcast talking about the fact that doctors don't learn anything about nutrition. You know, isn't that why we're here? Like, we are becoming more and more sick at an accelerated rate, chronic diseases left and right. I mean, people are coming out of the woodwork with that had never had health issues before, and no one is addressing the food system that's been hijacked, the toxins that we're consuming, the air we're breathing. I just saw Dr. Mercola posted an article about fluoride causing thyroid disease, and that is now researched. There's a study out. You and I knew that, right?
Yeah.
Because what is fluoride displacing? Displacing iodine, and we're all iodine deficient. Imagine that. And then also coming out with a study on Parkinson. You're going to love this one. Parkinson's is now connected to not just hypothyroidism, but T3. They actually said T3, not T4 or TSH. And I'm like, okay, so maybe this is going to wake up doctors.
Right.
So, I mean, I have family members with Parkinson's and dementia. What if they had taken care of their hypothyroidism earlier in life and didn't just succumb to the fact that you're supposed to gain weight when you get older and just let's eat the Doritos and drink the beer because we might as well, right? So
Wow.
it's like things are finally coming out. So maybe it's going to be in 20 years that doctors start testing for T3, and you don't have to be screaming at them with all of your symptoms.